Welcome back. So many of you may be noticing an increase in acne and other skincare issues from frequently wearing your masks, right? So we thought, you know what, it's time to talk about this because it's becoming more visible to so many people. And so with more on what to do about this, we have leading board certified dermatologist and medical director at Art of Skin, Dr. Melanie Palm, joining us. Dr. Palm, it's great to see you. It's been a while, even though I'm seeing you via Skype. How are you?
I'm great. And I know all my patients are seeing me like this these days. So
no kidding.
I know you guys don't have to do it on air, but for probably 8 or 9 hours a day, I'm doing this. I know so many essential and frontline workers are doing this too. And then everybody that I think is really, has a community-minded effort towards protection. We're all wearing that. But oh my gosh, the number of rashes that I'm seeing in my dermatology office that I think are being exacerbated or created by this is tremendous. So we can talk a little bit about it.
Yeah, so let's start at the beginning. I mean, what seems to be the problem? Is it with all different types of masks? Is it the fact that we're not washing the masks that can be washed, or what's going on? Where do we start?
Well, as you can imagine, when you've got something covering the lower third of your face, it causes problems in terms of changing in the skin environment. So changes in humidity, it changes the microbiome, which is the natural bacteria and yeast that inhabits our skin. That's actually a good mix typically, but things kind of get out of kilter a little bit. We're probably sweating more than we are, and we're probably getting a little bit more sort of bacterial buildup of the bad kind of bacteria. And so all of this can cause acne, it can cause rash-like symptoms, something called perioral dermatitis, which kind of looks like acne, kind of looks like a rash. And then we're also seeing sort of an increase in facial dandruff, a condition that we call seborrheic dermatitis.
Oh, wow. Yeah. So what do you do about this? I mean, aside from going to see someone like yourself, what can we do in the meantime?
Yeah, I think there's a lot that you guys can do at home before you need to see a board certified dermatologist. So I think the first thing is really effective cleaning. So just make sure that you're thoroughly cleansing your skin. I would recommend using some sort of foaming cleanse wash. This happens to have a little bit of salicylic acid. So if acne is a problem, I think that's great. Sulfur washes are something that we prescribe here in the clinic when people are having facial dandruff. It's really helpful towards acne. But there are masks that are over the counter, so look for something that's actually got sulfur in it. I think that can be super, super helpful. And then niacinamide, which is also known as vitamin B3, we use a lot in medicine. And in dermatology, we use it as an anti-inflammatory and anti-redness, and it has anti-acne capabilities. So I think using a topical or even having a sunscreen, because we want you still wearing sunscreen despite having the mask on, that can be tremendously helpful at helping with some of the breakouts.
Okay, that's good to know. You know, one of the things I've noticed too are indentations. And do we need to be concerned about that, or is that just because perhaps our masks are too tight and our skin will kind of, slowly, I guess, look normal again?
Yeah, so, as healthcare workers, we get fit tested for our N95 masks to ensure that they're actually fitting correctly. And they do fit quite snugly. So I'm sure that you've seen the videos and even photos have a lot of the indentations there. They get bruises, even skin abrasions. So something that's out there, there's a new technology. We were actually a study site for it. And it's a bruise cream for injectables, so sort of on the cosmetic side. But it has peptides, a trihex technology that repairs the skin, builds collagen and elastin, and helps create sort of clearance of bruises faster. So even though we use it for cosmetic means, I think it's actually a really excellent cream to consider using for skin repair. Just make sure, your mask should be snug, but it shouldn't hurt and it shouldn't be injuring the skin. So if you are having challenges, ask a healthcare professional to make sure that you're actually wearing your mask correctly.
Dr. Melanie Palm, breaking it down for us once again. Listen, it's great to see you. I know it's been a while, but we appreciate it because it's an issue we're starting to see now more and more since we're now have become so used to wearing these masks. And it doesn't look like, and it looks like we're going to continue to wear the masks at least for who knows how much longer.
please, everybody, wear your masks when you're out in public just to decrease the spread of this. Everybody, I think, in San Diego is doing a great job. So keep it up. And if you need trouble or you get into trouble, come see your dermatologist.
Dr. Palm, thank you. Take care. Have a great day.
You too.
Boardwalks and Piers are